So Hayley, we're standing outside the new Nightingale Hospital. It's being built as we speak. Are you impressed by how quickly it's been prepared?
I am so impressed. Never in my career have I ever seen a hospital built in the way that we've built the Nightingales, both in London, Manchester, Birmingham here and other sites. 20 days to build what is a hospital is just unbelievably impressive.
What's your job going to be here?
So as Chief Nurse of the Bristol Nightingale, my role is to ensure that our patients receive really high quality care, but also that our staff, our colleagues that work here are kept safe and that we look after their well-being.
What standard of care will there be here? Is it as good as being treated at a normal hospital?
Absolutely, I would really want to emphasise that. So yes, we're on a university campus and we've built it in 20 days, but the standards of care that we hold dear for our patients are the same standards that you'd find in any other hospital across the UK. We're working really hard to make sure that we are really consistent and paying attention to those standards.
Obviously we've heard that there are shortages of staff in the NHS.
Yeah.
How have you actually staffed this facility?
So that's really important because without the partnership of the hospitals around us in the Severn region, it wouldn't be possible. It is only possible because we're working together as one team to make sure that all of the intensive care units, including our Nightingale, is safely staffed. So we're heavily reliant on those colleagues coming to us from the other hospitals.
And will there also be trainee doctors and other kinds of retired staff who have come back to the NHS working here?
And I guess that's in some ways what's exciting is that we are attracting people back into the profession of nursing. We are attracting people back into therapy and medicine. We have got some retire and return folk coming to us. We've also got a variety of other professionals who've got some fantastic skills that can be used in different ways here at the Nightingale. For example, patient liaison, being that relationship between the patient and family at home is really important. We're really conscious of things like that.
When do you expect to see the first patients arriving here?
So we are on plan in terms of the build, so we will be ready early next week to receive patients, but we will want to work with all of the hospitals in the region to know when is the right time for us to receive our first patient.
And what stage of their coronavirus treatment will they be at? Will they be very seriously ill people here or people who are recovering?
No, the patients that come here will be very unwell, so they will be at the beginning probably of their intensive care journey. So they will not long have been placed onto a ventilator and they'll stay with us whilst they're on that ventilator, and we'll try and get them off of the ventilator and get them back to their home hospital.
I have spoken to some people who are horrified that this has been built, that they're terrified that a 1,000-bed hospital is having to be built. Others are reassured that this is here. How should people feel about this facility being in Bristol and serving the South West?
It's a really important facility. It gives hope because we know in the absence of this facility there may not be enough critical care beds for the patients in our communities. So we want people to know that there are enough beds in the South West for those that need them, and that no one will ever be in a position where we'll have to make a decision that's really difficult, because we've made sure by working together that we're ready. It may be the case that we don't need all of the beds here, and actually that would be a really good thing. That would be a really positive thing.
Could you see a world in which this is never used by any patients?
I suppose it's possible. We don't think that will be the case. If that happens, I'm not sure that's terrible. I think that, we're in a pandemic. It's quite difficult to predict what's happening. We're planning to make sure that we can face a number of scenarios positively in the event that they don't play out in the way that perhaps they're predicted. That's a good thing.
So it's not potentially a waste of money or resources that could have been put into our hospitals that already exist?
I think that's a question that the public will ask, and that's a fair question. I would hope that people would people would buy into that planning being really important, because it's giving us the confidence that should something change, we're ready. And we just don't know. It would be terrible to be in a place where we weren't ready. But I'm really, really pleased that we will be ready.
You normally work in Taunton.
Yeah.
What's it been like for you over the past few weeks? And tell me what it's like to treat people and to see people with coronavirus.
Yeah. So a patient who has coronavirus is no different in many respects to a patient that has another flu-like illness that comes with us. It's just a strain of flu, and we deal with flu every winter. So the barrier nursing that you see is because of the strain is slightly different. So I think from a patient perspective, it can feel quite strange to be nursed by someone in full PPE. But I know that my colleagues, my nursing, my medical colleagues, my therapy colleagues, they work really hard to make sure patients still have a relationship with them behind the mask. The patients that we've been seeing have been really poorly, and we've seen some patients in intensive care. I've also seen our first patient go home, when I was there before I came to Bristol, and that's really uplifting for staff to see that.
We saw yesterday how potentially the curve is flattening. Are you heartened by that? Do you think, OK, we're through the worst of it now?
I don't think we're through the worst of it yet. I don't think we have that full confidence. I think we've got some really early signs that the social distancing measures are having an impact, and we need to make sure that we continue to follow that government advice. I think we need to kind of hold where we are before we relax, I guess, because there's a lot riding on this.
As somebody who is in charge of lots of nurses across the southwest, what do you think is the importance of nursing right now?
Nursing is a unique profession. We touch people's lives in a way that leaves a lasting memory. Patients often tell us they don't remember what we say, but they always remember the way we make them feel. So nurses are there not just to provide physical kind of technical intervention, but really importantly to make sure that patients are cared for holistically. So mind, body and soul, that we are caring for the whole person and not just an illness.
If they are fearful of the coronavirus, maybe they have an underlying health condition and they are concerned about having to be treated somewhere like this, what would you say to them?
So you will receive the highest standard of patient care. We would urge you not to be fearful. The fantastic NHS staff that are coming to work at the Nightingale are highly trained, not just in the technical aspects of their role, but we're taking great care to make sure that people are trained to therapeutically, to have really have the right conversations with people, to make sure that they're connected with their families. And, we have to understand also that not every patient will survive coronavirus. So end-of-life care is something that, against the odds, we will do really well.
What happens in this situation if somebody is unwell, very unwell here, and it's looking like unfortunately the worst will happen to them? Can their relatives come and see them here at the end of their life?
So visiting has been a really difficult issue for us to navigate as the NHS and as nurses. For some patients at the end of life, it's absolutely critical that they have the opportunity to be with their family. Most families will want that, and we've made sure here at the Nightingale that we can do that in the right way that keeps the family safe and also keeps the people that work here safe.
It's very difficult to hear the numbers of people who die running into their hundreds each day. How do you make sure that each of those people who die, their family doesn't feel like they're just another statistic?
Yeah. I've heard of the most touching ways where nurses and other healthcare professionals have connected with family throughout the end-of-life period and also afterwards. It can be as simple as a photograph and some video footage. It can be as simple as a card from the nursing team that have cared for that person. and we always follow up after someone has died with us to check in with the family to make sure they don't have any questions, maybe a week or two later, because we know that that's often the case, and we want to make sure that wherever possible, that our families can grieve, if it's possible, healthily, and to continue to have a relationship with us afterwards if they need it.
So just to pick up then, no visitors will be allowed here as a regular thing?
So we're following the national model around visiting, and that's by exception, and end of life is absolutely one of those exceptions. I think there may be a situation outside of that where it's really important for a patient to have contact. So we can't have lots of visitors, and I know the public understand that, but where there are really exceptional circumstances, we will go and see if we can facilitate that.
Presumably your priority is also protecting your staff, isn't it?
Yeah, absolutely. So we've got a motto here at the Nightingale, which is safety first. Above all else, our staff will be safe, and that's our primary importance.
Do you worry about the mental health of your staff as well? This is such an unprecedented time that we're going through. How do you make sure that they stay well physically and mentally?
We have taken a great deal of time to plan what we're calling our wellbeing offer, which ranges from what staff physically need to what they emotionally and what they mentally need. We know that this period is causing all sorts of stress for everybody, including our colleagues. So we have mental health advisors, we've got mental health first aid, and people that need it can have counselling and even specialist psychology input. So we're very much here to prevent long-term scarring emotionally from being part of this pandemic, and we're encouraging people all of the time to say how they're feeling and to ask colleagues who are looking out of sorts if they're okay.
On a Thursday night tonight, we go out onto our doorstep and we clap for people like you. That's a very tiny thing that we can do. I wish we could do more than that, but how important is that?
It means an awful lot to the key workers, and I would stress that key workers aren't just the doctors and nurses and therapists. Our key workers are behind us with our construction company, and I look to my colleagues in social care who have a really challenging job. So I would want our public, when they stand in the streets tonight, to value everybody that's playing a part in the pandemic, including those that we don't naturally think about.
Just finally then, what would you say to people at home to prevent them having to use a facility like this? What can they do right now to stay well?
So the advice is really, really clear. Follow the government advice, the advice you've been given by your GP, particularly if you are classed as vulnerable. And, don't leave home unless it's absolutely necessary. Please follow the guidance. It is making a difference. We can see it. It's too early to say whether we can relax or not, so we need to persist. So please stay at home.
Hayley, thank you so much.
Pleasure, thank you.